Hi everyone, this is Abdul Chari from Starling Diagnostics. I have with me Dr. Nawaz Hussain from, again, Starling Diagnostics. He's also the medical director as well as the primary care specialist at Starling Diagnostics. Today we are going to talk about diabetes. How does it affect our overall health? Dr. Nawaz, you can start.
How you doing? So for diabetes, to understand diabetes, first we have to understand what is normal process of blood sugar. So when we eat, we take any calories, the sugar in our blood goes up, and we have an organ here called pancreas, and the pancreas releases insulin, and that the insulin is responsible for bringing down the blood sugar, and it uses up into the cell. It brings it into the cell for to be used as energy source. Diabetes, when you have, the insulin is not responding. Okay, so that's one of the criteria. There's insulin, but it's not responding.
Understood.
And another thing is, you could have, diabetes when there is no insulin. Okay, so the pancreas is not producing the insulin.
So what are the types of diabetes?
So there's type 1, and then there's type 2, and there's gestational diabetes. So type 1 is when you don't produce the insulin.
Understood.
And type 2 is when the insulin is there, but it's not responding. It's not doing its job. And gestational diabetes is when you're pregnant and you have high sugar.
Understood.
And you're considered
So most people have which type of diabetes? Like
about 80 to 90% of the people are type 2 diabetes.
Okay. When do you develop diabetes? Like, is there an age? Most of the people develops in this age, and
so usually when they're diagnosed very early, young age, most of the time is type 1 diabetes, but type 2 can happen at any time. Okay, usually for an adult, but they can happen also at young age also.
how do you develop type 2 diabetes? Is it from family history? Is it from obesity? What is the reason for
So
that?
type 2 diabetes has some genetic association,
Okay.
but most of the time is the lifestyle. People who are obese, they're at high risk for diabetes, and then family history is definitely.
Understood. And we talked about diet and exercise and how does it impact, how obesity impacts our lifestyle. So this is basically the same thing.
Yeah, so for like people who are obese, what happens is, our blood, our body stores the sugar as energy.
Understood.
Okay, and it stores as fat. Okay, and then that causes some inflammation, and that inflammation in turn causes insulin resistance. So the
Understood.
insulin doesn't work anymore. So obesity is definitely, a risk
Directly
risk factor,
interconnected
yes.
with. So let's say, how somebody says, I have diabetes. What does that mean? How does he know that he has diabetes? What are the matrix that we have to check to know that if you have diabetes, pre-diabetic?
Okay, so we have to know what's the normal blood sugar level, right? So in a fasting state, your normal blood sugar should be, for a normal person, it should be
Fasting state, when you wake up, when you have not eaten anything.
Right. So your blood sugar normally should be from 70 to 100. And after eating, it should be from 140 to 180.
Right.
And then you have your insulin do the work, and then gradually brings down the blood sugar back to less than 100
Right.
afterwards.
So as you know, Bronx is considered one of the, health-wise, one of the counties which is considered one of the worst as far as health. We have high diabetes, high obesity, high pregnancy rates, and so on and so forth, right? So why do you think is that? Like, Bronx is kind of disadvantaged in that sense. Why do most of the people in the Bronx has those symptoms?
Yeah, I think one of the main reasons is education. We need to have more knowledge about diabetes, and we have to implement lifestyle changes to prevent diabetes. We have to know when we are at risk, and we have to take action before the diabetes happens. So I think that's where we have to work.
And also maybe, we always talk about the importance of an annual health check. A lot of people don't do this annual health check. So a lot of people, they're like, oh, it's just a requirement from the insurance. But when if you're especially like 30s, 40s, that's when people start developing diabetes and things like that. Most people.
Yeah, almost 50% of the people don't know that they have diabetes.
What could be the indication? Like, how would I know if I'm not going to the doctor? What could be the indication that? What are the symptoms that?
Yeah, so what happens with diabetes is, your kidneys try to compensate for the high sugar. So what happens is, kidneys is getting rid of all the sugar through your urine, and that brings a lot of water along with it. So you urinate a lot.
So if you're peeing a lot, basically, right? If you're going to the bathroom a lot, that could be an indication that you may have.
and because you're losing so much volume, then you become more thirsty. So if you're drinking too much water, you keep going to the water, right? So that's another indication,
Right.
The increased thirst and increased drinking water.
So if you're feeling some of those symptoms, right, you can actually buy things like sugar check, to check your sugars on regular pharmacies and check that until you go to your doctor. And how diabetes impact your other diseases?
Other health, right?
Yeah,
So,
other health-wise.
Diabetes, what happens is when the sugar level is very high, it converts into something called sorbitol, and then that affects the blood vessels of the eyes, of the heart, of the kidneys, and it causes nerve damage also. So we don't realize this. When the sugar is uncontrolled, it causes very small damages to the small vessels, and over time it leads to, say, blindness. And then you probably know that with diabetes people get amputation because the nerves don't work anymore. These are the first two organs to get damaged, and then it can cause heart problem, it can cause liver problem, and then because the kidneys try to compensate, and then in turn kidneys also starts getting.
And that's why you sometimes call diabetes a slow killer, right?
Yeah.
Gradually
it affects all the organs.
Does people who are diagnosed with diabetes, I mean, they can maintain it, or they have to take medicine, or
No, so if you catch it early, most of the time for type 2 diabetes, you don't, if you catch it early, a lot of people don't require medication, because if you're exercising, what happens is the muscles uses up all the sugar, okay, for energy, right, during exercise. And also exercises increases the insulin sensitivity, meaning the insulin starts working better, okay, so in turn the blood sugar goes down. So if you're catching it early, sometimes just exercise is sufficient to control the blood sugar.
So just in summary, so basically our lifestyle has a big impact on it. What type of food we are eating, when we are eating it, and diet and exercise, and everything is the same exact kind of common sense, but it's not really common practice, right? So what are the, before we wind down, what are the suggestions you would be making to our audience?
Yeah, exercise is the key, right? If you have type 2 diabetes, you could start with exercise. Diet control, definitely. You have to decrease the carbohydrates. Everything that we eat has sugar. Okay, so it depends on what type of sugar you take. So low carb diet, like the rice, pasta, potatoes, these are very high concentration of carbohydrates,
Which is sugar, basically.
right? And then the starch, right? Rice is all starch, so this is very it increases the sugar load to very exponentially compared to other types of food. And also, if you have to take sugar, sometimes you could take artificial sweeteners also to replace.
Which is not cancerous. A lot of people.
Yeah, a lot of people think that there's tons of report there it causes cancer, but there has been extensive research where it nullified that. So there's no link to cancer with artificial sweeteners.
Is brown sugar better than the refined white sugar?
I don't think so, because a common belief is it is. But if you have to take sugar,
Artificial is better.
Artificial sweeteners is better.
But best is you don't take
right. So
sugar.
artificial sweeteners have like almost 0 calories. It's called free sugar because there's like almost 0 calories.
So I also want to add, like, if people, if there are among us, if there are people who takes a lot of sodas, right? They're drinking a lot of coffee and sometimes we don't realize how much sugar we are taking, right? And so on and so forth. Okay. Until next time, and we'll see you guys soon. Thank you, Dr. Nawaz.
Thank you so much.
Take care.